Eating and feeding requires the complex coordination of the brain with many nerves and muscles in the throat and the food pipe. If your baby or child are not able to do this safely, your doctor may recommend a feeding tube. The most common reasons for a baby needing a feeding tube are 1. Not eating or not absorbing enough to grow. 2. Problems with swallowing. 3. Swallowing into the lungs, increasing risk for lung damage. This is called aspiration. This can happen to a child with other medical conditions, such as heart, digestive system, brain, or developmental problems. Many children grow out of needing a feeding tube. This period of time can vary from weeks to years. Other children may need a feeding tube for a long time, but the type of tube and what it looks like may change over time. Ask your doctor how long they think your child will need a feeding tube. There are different kinds of feeding tubes. A nasogastric tube, called an NG tube, or just NG for short, is a tube that goes through the nose, down the food pipe, which is also called the esophagus, and into the stomach. Formula is then put through the tube to feed directly into the stomach. These tubes are placed and removed easily in the hospital. It can be a little uncomfortable going in, but once in place, children get used to them quickly. They will not prevent your child from eating normally if your child was able to do so safely before. But the tube needs to be changed every month, or it can cause problems such as sinus infections and skin irritation. If a child is vomiting or has problems with NG feeding, the tube can be placed past the stomach and into the small intestine. This is done less frequently due to the need for X-rays or other procedures to get it into the right spot. In this case, it is called a nasojejunal tube, or NJ. If your child will need a tube longer than 2 to 3 months, a gastrostomy tube, or Gtube, may be a better option. A Gtube is a tube that goes through the skin of the belly and into the stomach. Formula is then put through the tube to feed directly into the stomach. There are several ways a Gtube can be placed. Often, we choose a percutaneous endoscopic gastrostomy tube, or PEG tube. This is done with the use of a small, flexible camera called an endoscope and minimizes cutting of the skin. It is considered a minimally invasive procedure. To place this tube, your child will have to be under anesthesia. That means they will be completely asleep during surgery. The doctor will be able to use the camera to look inside the stomach and find a safe area to place the tube away from nearby organs such as the liver and the colon. Once the correct place is located, the doctor will make a very small cut on the skin. This allows for a thin metal thread to be used to pull the G-tube through the mouth and out of the stomach. The end of the G-tube has a soft bumper on it, which will keep the tube from being pulled out. A stabilizer on the skin side of the tube will help keep it in place. If the doctors can't find a safe place for the tube with the endoscopy camera, they may decide to place a G-tube a different way with the use of laparoscopic cameras or through open surgery. The skin and stomach will heal together, creating a connection called a tract. This takes about 3 months. Once it is healed, most children can have the tube changed to a short tube or a button, which sits flat against the skin. If your child does not tolerate feedings into the stomach, this tract can be used to place a longer tube called a gastrojejunal or GJ tube. This does not require another surgery, but will be done with X-rays. Feeds given by a GJ tube end up past the stomach in the small intestine. This may improve severe vomiting and problems with weight gain. These feedings are given slowly over many hours a day. After the procedure, you and your child will stay overnight at the hospital to ensure that your child is comfortable and everything is working as it should. The nurses will teach you how to use and care for the tube. Usually by about 7 to 10 days after, the tube is no longer painful to touch. PEG tube placement is overall a safe procedure which takes 20 minutes or less. Common complications include pain at the Gtube site, skin irritation, or leaking. Rare complications include bleeding, infection, and damage to nearby organs requiring further surgery. Your doctor will help determine which method is right for you and your child. Consult a medical professional for further questions or concerns.